name's Michael Jacobson. I'm going to be demonstrating how to do a needle decompression of the chest for a trauma patient with difficulty breathing. So, for needle decompression, some of the supplies that we will need are our stethoscope to be able to listen to lung sounds, alcohol prep pads to be able to prepare our surface, a 14 gauge 3 1/4 inch decompression needle, a 10 milliliter syringe to be able to aspirate to make sure that we're in the right location, and tape to be able to secure our site. One of our first steps is determining difficulty breathing related to trauma. This gives us an indication that we may have a pneumothorax and we may need to decompress the lung. Our next step is we need to expose the affected area so that we can visually see our patient's chest to find anatomical landmarks. What we need to do next is listen to lung sounds. We listen for trauma on either side. And we are looking for diminished lung sounds on one side or the other. One of the first steps, once we've determined that we have diminished or absent lung sounds on the right side of the chest, is to find our anatomical landmarks for our needle decompression location. We're going to first palpate the clavicle, and then just below the clavicle until you feel the first palpable rib. Above this is the first intercostal space. We're going to come down until we feel the next palpable rib, and just above that is the second intercostal space. We're going to insert the needle in the second intercostal space along the midline of the clavicle, just lateral to the nipple. Our next step, once we've found our location and have figured out our landmarks, is we need to cleanse the area, preferably with an alcohol pad or with betadine. We're going to start in small circular motions and work our way outward, disinfecting the area for approximately 30 seconds. Our next step is to select our 14 gauge 3 1/4 inch decompression needle. We're going to unsheath the needle so that our sharp is exposed. We're also going to remove the cap at the end so that we can hear the air when we puncture the pleural space. We're going to find our landmark, which is midclavicular, second intercostal space, just lateral to the nipple line. We are going to insert the needle at 90 degrees to the chest, inserting all the way down to the hub, and at this point you should be able to hear air rushing out of the chest. We are then going to remove the needle, which will go immediately in a sharps container. Our next step is to take a syringe and see if we can freely aspirate air out of the pleural space. If we do not meet resistance, it means we're in the pleural space and we have successfully decompressed the chest. Now we are going to take our tape and secure our site.